You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. And according to my first guest, nobody should be wearing a loose-fitting denture. With us, we have oral surgeon, Dr. Louis Craig. Dr. Craig, welcome to the program.
Thank you very much, Randy.
So in your practice, who's the typical dental implant patient you see as an oral surgeon?
Well, Randy, there really is no typical patient that I see in my practice. There are patients who have bleeding gums or what would be considered periodontal issues. There are patients who have multiple missing teeth due to trauma or accidents. There are also patients who are denture wearers who have lost their teeth over years, who would like to have something a little bit more stable to include implants, for instance. That really is the range of my typical patients.
So as an oral surgeon, I mean, general dentists from all around Houston send you patients
yes,
for implants?
Yes,
is that
yes,
right?
yes,
You work
they do.
together with them?
Yes, we work together. I also have an individual general dentist in my office. If they don't feel comfortable restoring implants or doing something implant related. But yes, they send me all of their great patients, some to include some of the things they don't feel comfortable doing. Happy to see them.
Okay, now, you have a unique center as an oral surgeon. I guess how implants are normally done is done at 2 or 3 places. One place does the surgery, like an oral surgeon does the surgery. Another place does the imaging, and then the implants are that another dentist puts the teeth on top. You have a system where it's all done right there.
Yes, I do. I have 2 practices. We have a general dentist in the office who puts beautiful teeth on top of implants if the referral source doesn't feel comfortable doing so.
Okay, good. Now, as an oral surgeon, do people need a referral to see you?
No, they don't.
Can they go to you directly?
Yes, they can. They can come see me directly. If they choose to, we can have a consultation, have a one-on-one, talk about life, talk about great Texas food, whatever they want to do.
Okay.
We can just have a good time.
All right, and we should mention, because you showed me in the green room some pretty graphic photos. As an oral surgeon, I guess as a military surgeon as well, somebody gets in an accident, you could rebuild their whole face.
Yes, the great thing about my experience is that I can reconstruct the face. My moniker, my email is "I will fix your face." So
is that right?
It really is.
Okay.
That is my email. So literally from the neck up, if you have an issue, I can take care of it.
Now I saw one of your photos with somebody in the military. They got their right side of their face, left side of their face blown off a little bit.
Yes.
And you put the whole thing back together.
I did.
And what I was thinking is, so implant dentistry must be easy for you compared to that kind of stuff.
I think it's not easy, but it's a little bit less stressful, let's say that. It's a little bit less stressful than some of the things I've done in my past, and I feel a great quality and to be able to provide that service to my patients.
What did you do in the military?
I was an oral surgeon. I trained residents in the military. I also was the chief of head and neck surgery in Afghanistan while I was in the military.
Is that right? Well, good for you. Congratulations. Now, I have to ask you this. At the top of the show, we said no more dentures, no more traditional dentures. Do you believe that? Like nobody should be wearing a denture?
I believe nobody should be wearing dentures. And this is coming from a person whose own parents wore dentures.
Is that right?
Yes, sir. I think really, well, they wore them. Let's just say most of the time they were on the kitchen table. However, I think now with technology, no one should be wearing dentures. With implants and the ability to have teeth on top of them, why not be able to chew better, smile better, just have an overall better lifestyle?
Now, your parents, were you able to help them at all?
I was not, and I feel like that is the service I'm able to push forward to my patients, but always here for them, and I think they will enjoy the process along the way.
Now, does it cost more to go to an oral surgeon?
No,
because you're a specialist?
No.
There's a lot of guys doing implants.
A lot of guys do implants. It doesn't cost more to come to an oral surgeon. It costs more to do it twice.
Okay.
But it doesn't cost more to come to an oral surgeon.
Now, is this true that when problems happen, they bring it to the oral surgeon? Is that right?
Yes,
and you do a lot of that? You help other guys?
Unfortunately, as clinicians, people have problems, but I'm the guy they send them to fix those problems. So if there's anything that needs to be done or any problems or issues that arise, as an oral surgeon, I can fix those problems.
Okay, good. Now, in Texas, where you are, in Houston area, are there a lot of people wearing dentures?
There are roughly 78 million people wearing dentures in the United States.
Wow.
About 2 million of those are roughly close to in the Houston or Texas surrounding area. So you can imagine, as much as Texas individuals love food,
okay,
not having stable teeth to eat with is a severe problem, especially in the area.
So if it's so good, right? If getting a brand new set of teeth supported by implants is so good. Why aren't they all doing it? I mean, like close to 2 million people. It seems like there's not even enough dentists to handle this.
It's just.
So what's your take on why they don't do it?
Well, my original take is this: if you have dentures, then you really are not in the loop to see a dentist, unless you need a reline, unless the dentures are falling out when you're Mrs. Jones singing in the choir.
Okay.
You're not really going to go see a general dentist. Then there's the other patient who's pretty much, they had a cavity, they had periodontal disease, they've had a root canal, they've had a crown, they've had the bridge. At that point, they're just done with any dentist, let alone an oral surgeon.
So it's hard to get them to come back.
It's hard to get them to come back.
Especially an oral surgeon, right?
Especially an oral surgeon.
Because when you go to an oral surgeon, you're in trouble.
Yes, we're the last hope.
Okay.
We're the guy that they see and everybody's just sad.
Do you still hear that? Like, no offense, doctor? What do they say?
Yeah, no offense, I hate you. And I laugh and I go, that's okay, because I like you and I'm here to take care of you. So we're gonna meet somewhere in the middle.
Now, do you see a transition like initially where they're really afraid, they don't like it, and then they change?
I do every day. I think both my staff and myself, we look to change a person's affect. So that person that comes in that's severely, has severe anxiety and or just doesn't want to be in the office, that cold sweat of sitting down in the chair, when they come back in that smile, in that hug that they give myself and my staff.
Is that right?
Makes the total difference.
They want to hug you.
They want to hug. They want to hug.
They don't want to hug you another, a great root canal. They don't want to give you a hug.
No.
A wisdom tooth. They don't want to give you a hug.
We get hugs and cookies and fruit all the time.
Now, what about the people with bad gums, like gum disease? Gums are bad. Can they still get implants or no?
Yes, they can.
Okay.
The first thing is to treat the problem, which is the bleeding gums or most likely the teeth.
Okay.
Once that is removed, then the implants are possible. Then going forward, total change in that particular.
So you could have bad gums and still do this?
Yes, sir. Yes, sir.
Even really, really bad gums?
Even really, really bad gums. And I'm seeing a lot.
So you just clean up the gums?
Clean up the gums, which is one of the benefits of having a general dentist in office. Cleaning up the gums, cleaning up the teeth, getting the patient orally healthy, then getting them implants.
How old can you be to get this done?
There is no typical age.
What's your oldest patient?
My oldest patient has been 90 plus years
Why
of age.
would a 90-year-old want to get implants?
Well, people love to chew, Randy.
Okay, that's
People
fair.
like to eat. I mean, I have world famous barbecue restaurant behind my office. The lines are around the corner. I send them from my office to the barbecue place to
What's
go
the
eat.
name of that place?
Killen's Barbecue.
Okay.
So people in Texas love to eat. So therefore they like to chew. And you don't really have the same chewing efficiency with dentures. That's just proven. So with implants and teeth on top of implants, that whole thing can change their whole life.
So how soon can they eat? After it's all done, how soon?
My patients can eat right away. Their diet is altered, of course.
Okay.
It's softer food. But after the implants are placed, they can eat.
So when they're all healed up, I mean, they could eat like a carrot using their front teeth?
Randy,
They can bite hard things?
They can bite hard things. They can eat carrots. They can eat corn on the cob. They can eat a well-done steak if that's what you so choose.
Okay.
Whatever you like, whatever your pleasure, you can eat.
Do they? I mean, do they tell you, like, Doc, could I eat this? Are they ever worried about eating?
At first, they're worried. But initially, most of my patients get mad at me because they gain weight.
Okay.
So the weight gain, they get mad at me about. The ability to chew and eat food, they don't. So I laugh because they've lost weight traditionally with dentures.
Okay.
They haven't been able to eat. They can't really eat steak or eat things with their family members or out with business. Now, they eat everything. So that ability to eat everything goes a long way.
Yeah, but I know a couple of denture wearers. They never complain.
Well, Randy,
Are
they're
you
not.
saying there's no such thing as a happy denture wearer?
No, I'm saying they're not going to complain to you. I mean, we have Mrs. Jones in the choir who doesn't tell the parishioners that she's been wearing a denture for 40 years. We also have the same Mrs. Jones whose husband doesn't know she has a wig. They never complain about their dentures because most of the time they don't want anyone to know that they actually have dentures.
All right.
So therein lies the problem, not that there is no complaints.
Now, so with people, even now, isn't it true though that if you've been wearing a denture for like 20 years or 15 years, you don't have enough bone to do this?
Not true.
Okay.
Everyone has enough bone. If you have enough experience to know where you can place the implants, which is why you come to an oral surgeon, which is why you come see me. Because most of my patients have been told they don't have enough bone.
Really? Okay.
Usually that's because the individual they are going to doesn't have the same amount of experience or ability to find the areas to place those implants. If you come to my office, if you talk to my staff, if you see my general dentist who works with me on a daily basis, we can treat you. As a matter of fact, Randy, I had a patient who came to me who didn't think they had enough bone to place implants. She had both bleeding gums, periodontal issues. Her kids had been more of a importance to her, which is usually everyone in today's society. This particular patient...
So they take care of the kids first,
yes,
rather than themselves?
Yeah, they take care of the kids first. This particular patient, there's a beginning photo of the patient. You'll see the bleeding gums, how they separated the teeth. You can see how they're...
So gum disease is what makes the teeth
yes, because
separated?
Because they become loose, or what we like to say is mobile. Okay. And eventually she was gonna lose most of those teeth. Matter of fact, taking an impression on this particular patient, we lost some teeth. That is how loose.
Like the gooey stuff?
Yes.
And the teeth came out with it?
And the teeth came out with it.
Wow.
And we expected that because of her issue in the bleeding gums. She came to speak with us about her options. What are her options? A denture, an upper and lower full denture. That's not a great option, especially for a young, beautiful woman.
Okay.
So we tried to give her alternative options to include implants and teeth on top of those implants, which she found much more of a viable option for her.
Okay, let's take a look. Is that her?
This is her.
I picture this to be an older woman as you were telling the story.
No,
just because of the teeth.
No, beautiful woman. Well, teeth can make you look very old. She had flat teeth, which comes as a sign of aging. She had space in between her teeth, which is generally what you see of a much older individual.
Okay.
But clearly, you can see
looks
that.
Good.
Yeah, she looks great. If you look at her teeth, that's by design.
Okay.
The curve of the teeth, the tooth show, the smile, everything that you see. There's this beautiful quote I like to believe. It's called the halo effect. Okay. If you see a person and they have one nice attribute, then you naturally attribute 7 other nice attributes to them. The smile is the window to the world. If that is what you can give to people, then they already believe you're a much more interesting, much more exciting, much more beautiful individual. That goes a long way. This can do that for you. People make assumptions about how a person's smile presents itself to the world. It can make you look older. It can make you look less educated. It can make you look less successful. This particular procedure, as attributed to this beautiful patient, can change all of that. Very beautiful woman, educated woman, very smart. However, her teeth didn't show that. The smile is the window to the world.
You say they don't want to smile.
They don't want to smile.
You have to even beg them, or not beg them, but to
it's
take
a beg.
the before
You're
photo,
right.
they don't want to do it.
They don't want to do it.
True?
I mean, we're trying everything. I'm jumping on, jumping on a chair. I'm telling jokes. I'm doing my best, comedic routines. They just don't want to smile. So you never really see the actual person.
Now, sedation. One of the advantages, I guess, going to oral surgeon, you guys do IV sedation.
I do.
I mean, are most of the people IV sedated, or just about everybody?
Just about everybody for this procedure.
And what's that like? I mean,
it's great. I bring in an anesthesiologist, or I do so myself because we have that training, and we make the patient comfortable so that they're not experiencing very minimal discomfort during the procedure, so they can have a pleasant process. After the fact, as I stated before, they have my number. They get medication to go home for swelling, the general things, bleeding, et cetera, to make sure that they have a pretty smooth process along the way.
Is this true? Some people almost have a little bit of amnesia, like they almost don't remember the procedure?
That is true. Most people have little to no recollection of the actual procedure even taking place.
They wake up at home and just go, whoa, where did I get these teeth?
Yeah, they wake up at home and I call my patients the next day and they go, Dr. Craig, I didn't remember anything. I woke up and they said it was done. And I go, yeah, that's it. And I go, that's what you came to me for. And they go, it was great.
Is this one of those things where people say, I should have done this years ago?
Absolutely. It's one of those things that usually people say I should have done it 10 to 15 years before, because that's the general course of individuals knowing that they were going to lose those teeth. But they were hanging on for dear life. At the end of the rope, they'd gone through the root canal, the bridge, everything had failed. They didn't want to lose their teeth, but they knew they were going to go. They just didn't know when.
So is this like the third set of teeth? You got baby teeth, you got adult teeth.
This would be the third set of teeth. Yeah, that's a great way to put it, Randy.
They can eat whatever they want.
They can eat whatever they want.
Chewy things, pizza,
nuts, as I stated before, steak, really anything they want. Hot dogs, which the ability to chew something you think, especially where we're in Houston, where you have the Astros and the baseball and all the things you can go to, chewing a hot dog. A denture is very difficult to be able to chew or give you the ability to chew even a hot dog.
So if they're in a game, they can eat peanuts if they wanted to?
Eat whatever they want.
So it doesn't matter?
Doesn't matter. You can be like most people and just eat the shells and throw them away.
Is that right?
That's right.
Okay.
So it's great.
Now, take me through the process. Okay, so a patient either has a full mouth of teeth that you can't save, full mouth of extractions, or they're wearing a denture. Mm-hmm. When they go to your practice, what are their options?
So the options are this, Randy. We can start with the lower jaw, for instance.
Okay.
I can place 2 implants where the denture would snap down on top of those implants, and you can snap it out. That's an option. The only problem with 2 implants is that there's a lot of maintenance with it. You have to go back and forth to the general dentist. You have to have the housings or the internal parts of the denture as well as the implant fixed because they wear out over time. So there's a certain amount of maintenance and cost that you're going to incur when you have those only, snap down type of teeth put on top of implants. Then there's the option where you have 4 implants that can either be a bar that's on top of those implants, which still snap in and snap out the teeth.
Now, I'm picking up on your facial expression.
Yeah.
And you're not a big fan of this snap in, snap out.
Not a great fan. I'm more a fan of something that's a little bit more fixed or stable because it gives the person the ability to chew a lot better.
That's what people want, right? Teeth that
that's
don't
what people
come
want.
out.
Teeth that don't come out. Teeth that they can chew or eat anything that they want.
Okay.
Teeth that they can smile, and individuals don't even know that they're wearing a denture.
Yeah, but the upper denture it has suction, right? I mean, it's pretty good.
It's not so good.
Okay.
It has a palate, so the individuals have a hard time tasting their food.
Okay.
It sometimes requires a lot of adhesive to stay. So if you don't have a lot of bone and you have a ton of, lack of a better way to put it, goop inside your mouth, food doesn't taste good, the denture falls out, you don't want to eat, you can't really chew because it flops and it's mobile. It's just not a great thing.
So what's the answer?
The answer is implants.
Okay.
The answer is implants. And since everyone is a candidate, there's no reason why you shouldn't take advantage of it. The option, maybe 4 or 5 implants on the upper so the teeth don't come out, and then you can go chew and eat like you always dreamed and have a pleasant experience.
Have you ever done somebody where you just do their lower and they keep their upper denture and then later they go, now it's loose, I want to get the upper done too?
Yeah, what I typically, that's funny you said that. What I typically tell people is, see me now or see me later.
Okay.
And that's how it goes. I would do the lower, they'll get 4 or 5 or 6 implants. And they go, no, doc, I just want to keep the upper. I'm not really worried. It works, I'm happy. Okay, that's fine. So be it. 3 or 4 months later, they come in, I've been thinking about the upper. 2, doc, what do you think about the upper? Can we do the upper one now?
Yeah.
Sure, it's no problem. I'm glad, I let them make the choice for themselves. As I stated, see me now or see me later, you're gonna want to have it done.
When it's all done, you say that you see personality change.
That's the greatest thing I see. I'll tell you about a teacher who came to my office when I first opened. She had the traditional 2 implants that were snapped on and taken it out, and she wasn't happy. She had been wearing that particular denture for 3 or 4 years.
Okay.
She asked me what could be done. Well, we turned those 2 implants into a fixed or stable option that's not removable. We added implants. She gained weight. She smiled. She was on retirement. She was enjoying her retirement. She came in. She was always happy. That was my segue into understanding how much of a physical change a person can have, both into mental affect as well as their personality. It's an awesome thing to see.
Now, we talked about this in the green room, that people with bad teeth are judged.
Yes.
Like in the movies, you want to make somebody look poor, you give them bad teeth.
Right.
What's your take on it?
My take is this: how many beautiful people? We're in the social media era.
Yeah.
We're in the everybody knows everything. How many people do you see without a beautiful smile? All you have to do is look for yourself. And there's a reason for that. Everyone who is popular, everyone who is successful, or it appears that way, has a beautiful smile.
That's nice. So it's kind of an easy fix. I mean, if you don't like your teeth, if you don't like your smile, do something about it.
Do something about it.
That you're feeling. Now, so what do they like more? Do they like, so somebody without teeth or a denture, what do they like more? The look or what they could eat and chew?
Well, it starts off, I think, with the look, and then it ends with the ability to chew. I think it goes back and forth. It depends on the original reason why they came to see me. I have had patients who come in and say, hey, I just want to chew better. I don't care what it looks like.
Okay.
I just want to chew better. And then they come back and go, you know, the 50-year-old male who's out on the market, as far as back in the dating scene,
or whatever, yeah.
He's like, you know, everybody tells me they love my smile. I didn't think that this would be as great of a change as it is. So it may start one way, but end the other. So fortunately, you have successful things that go along with unintended successful consequences from what you wanted.
Can you spot people that are hiding their smile? You say that they're like they don't smile. So people maybe think that they're miserable or depressed or mad or angry or something.
I see people who don't show teeth.
Could you spot them? You know they're hiding something under there?
Fortunately or unfortunately, I spot everything.
Okay.
You know, I mean, when you work on the face, when it's what you do every single day, I see everything. Some things I say something about, some things I don't. I wait for the patient to tell me. However, the lack and inability to smile is easy to see. A layman, or what we like to say, the common person. Everybody sees a person who doesn't want to smile. They could be happy internally, but their face depicts a different image.
Have you noticed that, especially with social media, that once you give them their brand new set of teeth, now they're on Facebook taking selfies all the time?
Yeah.
In fact, irritating their friends with all their self-portraits or selfies?
Yeah, the selfie generation, and now you have, and it's not just, look, I was a military guy. I hated social media.
Okay.
I paid more attention to social media now than ever before.
Okay.
It used to be the 20-year-old taking selfies. I see 55-year-old, 65-year-old, 70-year-old individuals taking selfies and smiling, and it's everyone. So if you have a smile, it goes a long way, and you present that to the world. That's what you want to do. Present your best you to the world. And there's no better way to do that than a smile.
And you're an oral surgeon. So you probably think that the smile is like the most important thing.
I think a smile is one of the most important things.
Okay.
Let's take a job interview, for instance. If you have two individuals who go in to interview for a job, one person doesn't smile, one person presents himself with a beautiful smile. Naturally, the person with the smile is more likely to get the job. Just because they're presenting an image that shows a positive affect, they're happier, they're more pleasant.
Okay, that's fair.
That's the person we want to be around. Who wants to be around an individual who doesn't smile? I don't. I don't know about you, Randy. I mean, if you don't smile, I mean, it's already bad enough.
They don't smile, so I don't want to hang out with them.
I mean, we don't want to go to work anyway, right? Who wants to go to work 8 hours a day?
Okay.
You definitely don't want to go to work with an individual who doesn't smile and you don't enjoy being around. So
these people kind of life changes. Like now that you could smile, it's like they get a different vibe about them.
yes,
People treat them differently, you told me.
they do. Different vibe, different affect.
Just because they're approachable?
Just because they're approachable. They're approachable, they're more affable, they appear to be nicer. They are people that everyone wants to hang out with.
Okay.
You know, everybody needs a friend.
Now we should mention this because we are literally about a minute left, but dental insurance, even the best dental insurance, doesn't cover the whole thing with dental implants. Medicare, Medicaid doesn't cover it at all.
Right.
So what's the answer?
The answer is financing.
People are financing.
People are financing these procedures. My staff, who is way smarter than me in terms of the financing option,
Okay.
we sit down and talk with the patients and give them multiple options to be able to have this particular treatment. So there is always a way. We will help you find that way. You just have to come in and speak with
So it
us.
doesn't matter how old you are.
Doesn't matter how
You
old
could be
you are.
95 years old.
You want to come see me.
What's the oldest? You said you had a 92-year-old.
yes.
What's the oldest patient you ever heard of that gets dental implants?
I've heard of
New
100.
teeth?
I've heard of 100-year-old patients getting new teeth. I have. I personally haven't had that
So
patient.
75 is young.
Yeah,
then,
75
to do
is
this.
young. It's young. I mean, there are people who are 75 years old dating now on dating apps. So
statistically, they're not more likely to fall out if you're 80 years old?
No, you're more likely to fall in because we're living longer. We're having more of an extended life. We're doing things much later in the process that we normally would. So that also includes maintaining your smile. Used to be, who cared if you had teeth when you were 75? Nobody cared. Now you have 75-year-old individuals who are dating. Of course they want teeth. They want to smile. They want to go eat with their friends, their family members. They want to eat at weddings, eat the cake, eat the food that's out there, and enjoy life.
Now, I'm going to put you on the spot here. You're an oral surgeon.
I am.
Do you have a bias? Do you believe that if you're going to do dental implants, talk to an oral surgeon?
I absolutely have a bias.
Okay.
You should have a conversation with an oral surgeon, preferably me.
Okay.
But you should definitely have a talk with an oral surgeon because with our experience, every patient has the possibility to have this procedure. No one falls out. And we can make sure that if something does happen to arise that needs to be corrected, we are the individuals to correct the problem.
Okay.
We're there.
This is what you do.
This is
all
what
day
we
long.
do, all day, every day.
Okay, so no more dentures. You're going to wipe them out then in Texas or Houston?
I'm going to try to.
Do you think that's the future of dentistry? Like whether it's 20 years or 50 years, that dentures as we know them, just sitting on nothing, will be gone? They'll all be attached to something?
I think they will because like everything, technology is getting better. Guided surgery is available for those patients. At some point in time, hopefully we'll see no more dentures.
No more dentures.
No more dentures.
All right. I want to thank you for coming on the program.
Thank you, Randy.
So you offer a free consultation if somebody sees this program and goes in, and you'll actually get to see them?
Yes, they will see me.
Okay.
My patients see me, we'll have a conversation. I also tell my patients, no question's a bad question, because unfortunately, patients don't want to ask their doctor a question. I leave the room, they ask my staff 15 questions.
Okay.
So eventually they feel comfortable enough to know that I will answer their questions. Whatever that question may be, there is no quote unquote dumb or silly question. Whatever makes you comfortable, that's my job. I want you to feel comfortable and get all your questions answered.
Good for you. I want to thank you for coming on the show. I mean, good stuff. Because I know you have everything we're talking about, you teach other dentists.
Yes.
Is that right? You teach implant dentistry.
That is true. I've been teaching for 8 years now. I also provide courses and continuing education on this particular procedure amongst all the other things that I do. So yes, this is what I do all day, every day.
And dentists, let's say somebody loves their dentist, right?
Yes.
They could still use their dentist.
Of course.
And still get implants with you and work together.
Of course.
Is that right?
Yes, that is correct. I provide the service if you don't have a general dentist. However, if they have a general dentist who wants to work with me, by all means, we're there to help them and to also help them with the educational process as well.
Okay, good. I want to thank you for coming on the show. Good stuff.
Thank you. Thank you very much.
Appreciate it. You've been watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.